Health Minister Dr. Christopher Tufton says the ministry, with support from donors and international partners, has turned to the use of field hospitals to meet the growing healthcare needs in Jamaica's western region. The move comes as part of ongoing recovery efforts following Hurricane Melissa, ensuring that critical medical services remain available to residents in the most affected areas.
We also want to thank the donor community with 3 field hospitals, Mr. Speaker, another very important response to the hurricane. You would have seen that within a week, a field hospital was established in Black River to take off the load that was created based on the decommissioning of the Black River Hospital. And that is almost record deployment, Mr. Speaker, which I want to thank Samaritan's Purse, but also the support of the government, of course, who negotiated and coordinated the quick the deployment of that facility, and also the JDF and others who have been part of this process. I went there up to Sunday evening at night, and it is functioning well with the team, both local team and the NGO's team. And I believe the people of Black River and St. Elizabeth can be assured of health services should anything occur, particularly emergency cases at that field hospital in Black River beside the Black River High School. There are 2 other field hospitals that are being established, and as we speak, the field hospital at the Falmouth Hospital is now commissioned and in service. A similar hospital, this one established by the Spanish government in conjunction with the government of Jamaica. And I want to commend the people of Spain for this.